Recently, 15 orang asli died and 100 more are being treated, apparently after contracting measles. Lack of access to healthcare may have prevented them from being vaccinated. But why are some Malaysians choosing not to vaccinate their children? Vaccinations have been part of national health programs for decades and help prevent serious infectious diseases like measles. Before the measles vaccination was introduced in 1963, major epidemics occurred roughly every 2 to 3 years and caused around 2.6 million deaths each year. Vaccinations have minor side effects like swelling and fever, but in some cases can cause something more serious like an allergic reaction. This is incredibly rare though. Experts say it happens in less than 1 in a million cases. Despite this, in 2019, the World Health Organization listed vaccine hesitancy as one of the top 10 threats to global health, reportedly causing the resurgence of previously eliminated diseases. This anti-vax movement is gaining support in Malaysia. Statistics from the Health Ministry show a sharp rise in vaccine rejection in government clinics, from 600 cases in 2013 to almost 1,500 in 2017. The number of measles cases recorded shows an almost 1,000% increase in a similar period of time.
The bulk of the anti-vaxxers in Malaysia are the internet-savvy professionals who are mainly in the urban settings. And the bulk are Muslims, and they say that ia bertentangan dengan kehendak Allah. JAKIM has made it very clear that all the vaccines in the National Immunization Program are permissible. And in fact, some of the muftis who sit on the National Fatwa Council has made it mandatory.
In the case of the Orang Asli, many of them miss vaccinations due to poor access to healthcare. They also have a high rate of school dropouts, meaning many children don't receive their school injections. Whilst much more needs to be done to resolve these issues, one way to keep the Orang Asli safer from the threat of disease is to make sure the rest of the population is immunized. This is what's known as herd immunity.
If I was not immunized for measles and I acquired the disease, then the risk of the others around me getting the disease is 90%. A child who is not vaccinated for whooping cough has a 23 times risk of acquiring the disease and spreading it to others. So what becomes one person now becomes many people and leads to an outbreak. We have a responsibility to prevent those who cannot be immunized, i.e. those who are young, those who are very old, those whose immune systems are very weak, and they depend upon herd immunity to protect them.
The magic number for herd immunity is around 95%. That much immunization coverage is required to protect the remaining 5% or so who are unable to be vaccinated. In Malaysia, we almost reached that magic number with measles, mumps, and rubella immunization rates at 93% in 2015. However, it's fallen to 89% in 2018. Earlier this year, after an unvaccinated 2-year-old boy died from contracting diphtheria, the government considered making MMR and diphtheria vaccinations mandatory. Some groups even call for unvaccinated children to be barred from attending school.
Saya tidak pasti sama ada akhirnya kalau diletakkan sebagai mandatory dan compulsory itu, apakah dia juga akan berakhir untuk mendapat kelulusan di Parlimen. Apapun kita akan mulakan perbincangan itu.
And a short discussion it was, ending with this.
Prinsip asasi kami selaras dengan hak asasi setiap rakyat untuk mendapat pendidikan. Anak-anak berhak untuk pergi ke sekolah. Sama ada ibu bapanya memilih untuk divaksin ataupun tidak, sekolah tidak boleh menghukum anak-anak di atas pilihan ibu bapa mereka.
In any case, is there a way to force an individual to get vaccinated for the safety of the community as a whole?
If you were to ask me whether it's a violation of human rights, the basic answer is you cannot touch me unless I consent. That should be the general rule. The next issue is what is a human right? You see, our human rights are the human rights which are enshrined under the Constitution. Now, if you were to ask me whether you have a right to education and whether a person who is diseased, let's go on that premise, a person who is diseased can go to school and infect other people, then you have to fall back under the two articles, Article 9, Article 10. Which means you cannot assemble anywhere you want. You cannot just associate with anyone you want if there is a threat to public safety and also public health. So if, let's say, you were to ask me whether these two articles in the Constitution trumps the right to education, it may.
In the Malaysian context, mandatory vaccinations would need quite a bit of lawmaking.
If you were to talk about children per se, maybe you need to amend the Child Act. But if you're talking about community at large, you probably need to amend the Prevention and Control of Infectious Disease Act. There are no sections now because the provisions which are relating to vaccination are basically on neglect. So when a parent actually neglect a child's health, then the definition of neglect, whether it includes vaccination or not, will have to depend on the court to interpret. So these are the provisions that you have to actually do the amendment.
Balancing the evidence benefits of vaccinations against the right of the individual to choose, this has been a matter of debate in many countries. Each handles the issue in different ways with different results. For example, Slovenia introduced hefty fines for parents who fail to immunize their children. Australia forbids unvaccinated children from attending preschool and childcare centers, but also has a positive vaccination policy. Parents receive family tax benefit for vaccinating their children. Both these countries have between 90 to 95% immunization rates. Then there's Finland, with a near universal immunization rate of between 95 and 99%. Their child welfare clinics are well funded. Regular and free visits to these clinics are the norm in Finland. This, along with their awareness campaigns, may have helped stop anti-vax movements from spreading. So, what should Malaysia do?
The suggestion by the health minister that we make diphtheria and measles vaccination mandatory is actually a very wise decision, because we need to make sure that the areas where measles and diphtheria is endemic can be sorted out. And whilst this is going on, we must make sure that owners of childcare centers, of kindergartens, of nurseries check the vaccination record of all of their children. And those who are short on the vaccines are referred to the Pusat Kesihatan to be immunized.
There is no one-size-fits-all approach to improving vaccine uptake. Some countries with mandates, such as Australia, have high vaccination rates. Others, such as Finland, achieve similar results with that mandate. However, we also need to understand that vaccine rejection often emerges from fear and false information from parents that are trying to do their best for their child. While making vaccination mandatory is one seemingly easy option, it's also important to wage war on the spread of fake news.